Hi, welcome to Mera Doctor, and today we're going to talk to Dr. Prashanth, a renowned ENT surgeon from BGS Global Hospital, and we're going to be talking about thyroid in this episode. So, Dr. Prashanth, when we generally talk about thyroid, what I understand is, commonly people say that I have got thyroid problem and I've started gaining weight or I've started losing a lot of weight. But generally, I think it's just a body organ. I might be wrong, but can you give us a little more clarity on what is thyroid and what should be done?
So first and foremost, let me clarify that. So everyone will have a thyroid gland. It's just that the thyroid gland is a normal gland which is there in the neck area. So it's an endocrine gland. It secretes a thyroxine hormone. So that hormone is associated with metabolism of the body. So that is a very essential hormone which is required by everyone, for everyone. So there are two types of thyroid disorders. One is a hyperthyroid disorder and the other one is a hypothyroid disorder. Hyperthyroid disorder will be when the thyroid gland will be excessively producing hormones, wherein you start feeling more hot, you will start losing weight, you will be losing hair, you will be having tremors, all the other symptoms which will be there associated with a hyper-secreting thyroid gland, which is called hyperthyroidism. The same thing when the thyroid gland is secreting less amount of a thyroid, so it is called as a hypothyroidism. So what happens in hypothyroidism? It's the reverse of hyperthyroidism. So the patient will be metabolizing less. So that means even if the patient is feeling less hungry, he or she is gaining still more weight. So one other major common myth which is associated with thyroid issues are it is only associated for females. Not many males are affected. Well, that's a very wrong assumption which is seen. It is a issue which is there in both male and female, just that a bit of tendency is towards female. So that doesn't mean that none of the males will be having a thyroid issue. So with hypothyroidism, there can also be something called as a goiter. What is goiter? Goiter is nothing but a thyroid gland which is enlarged in the front part of the neck.
Okay.
So the goiter can be again hypersecreting or hyposecreting. So we can get to know whether it is hyper or hypo based on few blood tests.
Okay. So when you say, there is enlargement of the thyroid glands, so it does not necessarily mean that it's hyperthyroidism.
Not necessary, not always. So when there is a lower secretion of the thyroid gland, thyroid hormone, what happens? There's a master gland called the pituitary gland in the brain. So that secretes a thyroid stimulating hormone. So when the thyroid hormone levels are less, the secretion of the TSH, that's thyroid stimulating hormone, is more. Secondary to which the thyroid gland will increase in size because of the high secretion of TSH hormone. So when there is a high secretion of TSH hormone, the gland increases further and further and further. But it doesn't always mean that it will produce same amount of thyroid hormone.
Okay.
So it becomes a goiter.
Okay. So another thing I think commonly people associate it with thyroid is that, one thing I'm at least clear now is the thyroid itself is not a problem. It's just the TSH levels in the body which has to be monitored, and as long as that's in control, I think we are good, right?
TSH is basically one of the hormones which we can get to know whether it is hyper-secreting or hypo-secreting.
Okay.
So if the thyroid secretions or the thyroxine levels in the blood is high, secondary to the intake of thyroxine, which is the thyroid medication, then the TSH will be low.
Okay.
But if the TSH is also high and thyroid hormones are also high, that means the body itself is producing high amount of hormones.
Okay.
So there is a delicate line which will be there. So we can't just say that for all cases it will be the same. It is per case basis. So each case we need to evaluate with the different thyroid levels. So we get a thyroid profile wherein we have TSH, thyroxine, that is T4, and T3. There are two different types of hormones which are secreted by thyroid gland, the T3 and T4.
So when you say that a normal patient who thinks he or she is suffering from hyperthyroidism, because of which they are experiencing certain symptoms, what are the first steps that you would advise? What do they do? Do they visit an ENT doctor, or do they just go up for a general body checkup, or what is your advice?
My advice would be, anyway, there is over-the-counter thyroid profile testing being done. Get the thyroid profile testing done. Visit either the ENT surgeon or the endocrinologist. Either of them can check and evaluate what needs to be done next. If there is an associated enlargement of the thyroid gland, we would advise to go for a ultrasound neck, wherein we scan the neck to check if at all there's any associated lymph nodes which are enlarged. So why we need to check with ultrasound is because if there is a hyposecreting thyroid, we also need to rule out if at all there is any kind of a tumor associated in the thyroid. So with that, we'll assess it, and if at all there is any associated enlargement, specifically a solitary nodule, one nodule which is seen inside the ultrasound, we would advise for a FNAC, fine needle aspiration, wherein where we send the patient to a lab where the pathologist will pass a needle through the neck into the thyroid gland, take a piece of tissue, analyze it, and then we wait for reporting.
Doctor, usually when women gain weight, they tend to say that, I've got thyroid issues because of which I'm gaining weight. Is that the only cause or primary cause maybe around it?
So, when women especially gain weight, one of the reasons will be hypothyroidism. It can't be that it's the only cause for weight gain. Many of times, the women will be having PCOD issues, wherein they will gain weight secondary to the other hormonal issues. And thyroid being secreted less can lead to weight gain, but it is not just the primary cause for weight gain.
So when a man or a woman is gaining weight, is thyroid just the only cause, or is it very specific to women alone?
So thyroid is a normal gland which is there for both men and women. So you can't just say that only women will be suffering from a thyroid issue. Men also equally can suffer with a thyroid issue. It can either be because of hypothyroidism or hyperthyroidism.
Okay. So are there any specific tests, or how do we get to know? Are there some symptoms that will specify that it's a thyroid issue?
So if you want to specifically understand whether it is a thyroid issue or not, we need to get a few blood test evaluation done. So after the blood test evaluation, we can specifically say that this is one of the causes for hypothyroidism. But when there is an issue with thyroid, it doesn't mean that it is the only cause for the weight gain.
Okay.
There can be associated other issues or other hormonal imbalance also which can cause the weight gain.
And it's common for men and women?
Yes, it is common for both men and women. Just that women, since they are more conscious of their weight, they tend to associate it with it more than men do.
And doctor, what are the symptoms of thyroid issues with men and women?
So there are two types of thyroid issues which are usually seen. One is hypothyroidism, which is secretion of lesser amount of hormone. So in that case, most common symptom would be them gaining weight. Number two would be they feeling cold even in summers. Number three would be hair fall.
Okay.
And for hyperthyroidism, where the secretion of hormone is more, it will be the reverse of hypothyroidism. So what happens in that? They feel hot even in winters, where they sweat more, they lose weight. And again, one common issue would be loss of hair.
Okay.
With both hypothyroidism and hyperthyroidism, in women, there will be an issue with the periods. In hypothyroidism, sometimes there will be high amount of blood flow. In hyperthyroidism, there will be less amount of blood flow.
So doctor, is having a thyroid imbalance, is that life-threatening? And if it is not detected early or not detected at all, can a person just lead a normal life?
Yes, a few of the conditions in hyperthyroidism can be life-threatening. If the secretion of hyperthyroidism or the hormone secretion is very high, then it can lead to malignant hyperthermia, wherein the body temperature can go very high. In hypothyroidism, it can cause secondary life-threatening situations because of increase of cholesterol buildup.
Okay.
So the patient can have a heart attack or the patient can end up with a stroke. So going undetected is indirectly and directly
Life-threatening.
life-threatening at times. So getting it evaluated and getting it treated correctly by a doctor is very essential.
So, doctor, when you say that it causes a lot of hormonal imbalance, does that mean that for certain people it causes psychological issues as well?
Yes. So hyperthyroidism and hypothyroidism both cause psychological issues. With hypothyroidism, there is a high chance of the patient going into a depression. And with hyperthyroidism, the patient can go into the opposite side of anxiety and psychosis, wherein the patient will be more fearful, very anxious, and there'll be other psychological issues if you don't treat the underlying condition immediately.
Okay. And so when we say that it can cause depression or it can cause a lot of anxiety, does that mean that certain times when somebody is feeling a lot of anxiety and or depression, they need to go for a general checkup, or is it pretty much this that causes it?
Well, the psychological issues are associated with stresses in life, so that can have an impact on the body as such. So going for a whole body checkup would be better annually to assess how your body is taking the stress.
Okay.
And if there's an associated thyroid profile done in that, it will be good enough for everyone.
And so when we say that it can cause a lot of stress, is the reverse also true? If somebody is going through a lot of stress, can that trigger thyroid issues?
It can be possible, because it's, as they say, it's mind over body. So any kind of a stresses in the brain can affect the thyroid also.
So doctor, I've heard of some women taking thyroid medication just to reduce weight because it's a symptom, right? How safe is it for the patients?
It is absolutely disastrous. If the patient, if the person is having a normal thyroid and starts taking thyroid medication for just reducing weight, it will have devastating effects on the whole of the body, not just on the fat. So it is absolutely not recommended to take over the counter or thyroid medications without a proper evaluation of the thyroid levels.
So generally, doctor, if a patient needs to go in for a thyroid blood test, how long does it take and is it complicated process?
It's not a very complicated process at all. Only thing which you need to ensure is you need to go in an empty stomach in the morning, preferably, to give your blood test. So they'll just draw your blood around 5 ml and they'll give you the report in about 3 to 4 hours time.
Okay, so just the procedure itself is about 5 minutes.
Just the blood test is about 5 to 10 minutes.
And also, in certain cases, when the thyroid glands have to be removed for a patient, can the patient survive and have a normal life leading up to his old age?
Yes, definitely. So that's when we utilize the thyroid hormone replacement. So where we give thyroid medication with a titrated dose for the individual patient. And the patient can definitely survive without the thyroid by taking the medication correctly.
So doctor, to ensure that we keep our thyroids healthy and keep ourselves healthy, what are some of the things we need to do?
So the most common thing which you have nowadays is the iodized salt. So ensure that you have sufficient amount of iodized salt, not too much such that you gain hypertension, but sufficient to ensure that the thyroid is functioning normally, because iodine is very essential for the thyroid to function. And also get an annual body checkup which covers thyroid to ensure that your thyroid levels are in check, and you can have a constant feedback or a record to see how you are progressing. Beyond that, I don't think anything extra is required for specifically for well-being for thyroid.
Okay. Thank you, Dr. Prashanth, and we'll see you with the next episode.